Of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. We've been thinking, Doctor, about the health risks following Hurricane Harvey. What are some of those?
Amanda, there are both physical and mental health risks. First, focusing on the physical, you got to consider that floodwater is more than simple rain. It's often contaminated with things like sewage and chemicals. It may contain sharp objects made of glass or metal. We're talking a very dangerous situation.
Obviously not something you drink. Maybe, what about items that have been contaminated with floodwater?
Yeah, any of those items could certainly affect you. And here the major concern is diarrhea or some type of stomach problem. And so anything that's been submerged in this contaminated floodwater really should be washed first. The CDC is warning parents that their children should not play with toys that have been submerged and that they should be thoroughly washed first.
Wow.
So anything other than stomach problems that they should be concerned about?
Yes, gastrointestinal problems aren't the only concern. There's also concern about skin rashes, ear, nose, and throat problems, and conjunctivitis.
So what can these people in close quarters do to kind of avoid some of this?
One of the biggest concerns when we speak about stomach problems and diarrhea is the transmission of these problems through close contact. So you have to think a lot of people are sheltered in place with a lot of other people. So they really need to remember to exercise proper hygiene and not to further transmit that disease.
Yeah.
So what about after the floodwaters recede? Is there any concern with the cleanup itself?
Yes, you have to think of that Texas environment, which is warm now, humid, just the perfect place and petri dish for mold to grow. And so people really have to be careful about that mold that can quickly grow and being sure about that impact upon their asthma and exacerbating it or upon triggering other allergies.
So what's the best way to clean up then? What are your recommendations for cleaning up here?
Just a thorough cleaning, just
Yeah.
Using disinfectant, soap and water, exposing the contaminated items to the sun.
You said physical and mental. What mental and will it affect? I would imagine it affects everybody differently.
It does, and it could be, Amanda, that one of the greatest long-term effects from this hurricane as the floodwaters recede will actually be not so much the physical, but rather the mental effect upon people. And here we're talking about an increase in stress, anxiety, depression. You know, these brave Texans really have borne so much, and many have lost so much.
I can't imagine going through something that terrifying.
Yeah.
Although I suppose some people go through that and they just are fine. But I mean, especially kids, would they have recurring feelings of not being safe and secure and would need, I guess, therapy or counseling of some kind?
Well, you know, for some people, it's really a testament to their resilience, and particularly to some children, they may actually see in this optimism for the human condition of how they've been in a struggle, in a tragedy, and yet there's been incredible outpouring of help. And so there's a rejuvenation, just a faith in the human inclination to reach out. I think it's a wonderful thing.
Kind of looking for the good in a situation like this.
That's true.
Yeah,
Doctor, it's always good
great.
to talk to you. Thank you for the information.
This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.